When will our healthcare system see real change? And could Coca-Cola offer us a lesson? Stay tuned for Health Politics.
Welcome to Health Politics with Dr. Mike McGee, a weekly program exploring important trends in health.
Today's program concludes our three-part series in which we've taken examples and stories from various sectors of industry and related them back to healthcare. The point of the series? To show that we can learn from other sectors and take what they've already succeeded or failed at and apply this knowledge to healthcare as we continue to strive for an improved system. These comparisons work because healthcare is an industry, just like transportation or energy or manufacturing. All industries deal with many of the same outside forces that are changing so rapidly that it's difficult to stay ahead of the curve. So many trends today, like high-speed travel, use of the internet, consumer empowerment, disintegrating geographic borders, and multi-generational families, are creating irreversible circumstances that are challenging business in every sector. I'll get to today's business comparison, Coca-Cola, in just a moment. But first, let's review the current state of our healthcare system in its interventional, reactive, and high-cost state. For all the talk about moving toward a preventive system, it's never been more difficult to connect with information, reimbursement, healthcare coverage, and a coordinated care team that knows what it's doing. The healthcare system as a whole is obviously stressed, which is recognized by many of its leaders, including hospital administrators, physicians, nurses, and employers, who feel like their hands are tied. Hospital leaders struggle with out-of-date governance when they really need to be changing their processes around a common language, tools, and mission to make their institution safe and effective. Physicians are struggling with a reimbursement system that is fundamentally reactive and dealing with an office environment that is not designed to support the preventive lifespan management needs of their patients. Nurses find themselves locked in an extended battle over independence and prescription writing power and struggling to protect their patients in complex, broken institutions with fewer hands to help. And healthcare insurers are busy pursuing yet another approach to contain costs, maintain profitability, and their long-term competitiveness when it's clear that preventive healthcare requires loyal doctors and patients, multi-year planning, and financial investment. And then the employers who are focused on controlling healthcare costs at a time when productivity, loyalty, and innovation are required to adjust rapidly to unprecedented global environmental changes. Consumers continue to try to teach themselves how to manage the bizarrely disintegrated matrix of health and financial decisions at a time when their three-generation family model has morphed into 4- and 5-generation complexity. Now, despite all this, there is some good news. The movement toward patient empowerment and home-centered preventive care gains speed each day. As our world changes and forces such as the aging population, globalization, and the internet collide, a new value proposition is upon us. None of the traditional healthcare players denies this change or the need to find a new way of doing business. How we get from here to there is the outstanding question. And how will all the players survive in the new world? Enter the story of Mexican Coca-Cola for comparison's sake. It's been popping up on shelves in mostly small grocery stores around the U.S. in scuffed glass bottles whose design dates back to 1916. How it gets the hundreds of miles from Mexican bottlers to Atlanta, Phoenix, or Dallas may at the end of the day be less important than why. But if you're curious about the how, it seems that cases of Coke produced in 13 company-authorized bottlers in Mexico get into the U.S. via an underground supply chain that has nothing to do with the company's long-established distribution system. This is particularly annoying to Coca-Cola because sales of Coca-Cola Classic have been dropping in the U.S. since 2000, while sales of the bootlegged Mexican Coke continue to rise. These trend lines, as well as the storyline here, are tied to a rise in the U.S. Hispanic population, which has tripled over the last 25 years from 14.6 million in 1980 to more than 43 million today. Why is Mexican Coke being brought across the border? Drinkers say it has a better taste and mouthfeel than the U.S. formula. That's right, there's more than one recipe for Coke. U.S. bottlers switched from cane sugar to high fructose corn syrup in the 1980s to cut costs. The Coke made in Mexico still contains cane sugar, and Mexicans in the U.S. clearly prefer the taste. In fact, they like it so well that their loyalty seems to gain in strength the farther they are away from home. The drink costs 30 cents if you buy it in Mexico, but drinkers are willing to fork over $1.25 for it in the U.S. The increased price comes from the fact that the underground distributors pay 63 cents per bottle at the border and receive 75 cents from the U.S. grocery store owners who price the bottles at $1.25 to realize a 50-cent profit. Corporate Coca-Cola has tried a variety of tactics to satisfy its understandably irate U.S. bottlers and to stop the flow of Mexican Coke, which, by the way, is not illegal since it's not counterfeit. The company has sent cease and desist letters to the grocery stores, and they've fined Mexican bottlers. It even plans to raise the price of its syrup in Mexico for the first time in more than a decade. But at the end of the day, Coca-Cola headquarters is beginning to acquiesce. The company has started shipping small quantities of Mexican Coke to the U.S. in an experimental capacity. But there's one problem. The drink isn't selling as well as it does when the unauthorized distributors bring it to the stores. Why? It's being distributed in shiny new bottles instead of the scuffed glass bottles the Hispanic population says add to the Coke experience. Maybe headquarters will get it right eventually, but it's important to point out how the company has recognized the need to adjust to the unstoppable environmental change affecting its business, instead of continuing to try to squash it. This ability to adjust and adapt should not be lost on healthcare leaders and professionals. When it looks like you're hitting a brick wall, don't keep hitting it. Try a new tactic. For Health Politics, I'm Mike McGee.
Thank you for watching Health Politics with Dr. Mike McGee. For more information on this topic, please visit our related web links, discussion guide, or downloadable transcript and slides. For videos and information on a variety of other health topics, visit our homepage at healthpolitics.org. If you would like to subscribe to our free weekly video, click on Subscribe to Health Politics and enter your email address. Again, thank you for watching.